Massorti Judaism. Care for the elderly and the vulnerable is something we've been listening to from both ends, both the point of view of the cared for and the carers. And we've spoken to Jewish Care, to Barnet and to Bupa, and a wide coalition has been formed of people concerned with this issue. It's begun in Barnet, it's moved to London citizens, and now they're the seeds of a national campaign. We're going to hear from Michelle Simmons from Finchley Reform Synagogue and from Perrin Rowland from Penrose Care, who will share their stories.
I'm Michelle Simmons. I was first approached about getting involved in the care campaign over 2 years ago. I didn't think twice about it, and about saying yes. This is the reason why. My mother had suffered with dementia for over 8 years, and within a very short space of time, I delved into the underworld of care, carers, hospitals, and lastly care homes. It was like being parachuted into another country, where I suddenly no longer knew the rules, who to talk to, where to go for help, and worse, how to protect my mother. It wasn't that those who cared and came into contact with her were willfully mean, for want of a better word. It was more a case of not seeing that my mum was unable to talk or even move because of her limbs, etc. She actually couldn't do anything. She was at the last stage of dementia. She became invisible, and so did her needs. Whether it was toileting, which is a political expression was used, or even being fed properly. I remember one carer had loaded up a spoon of food, and as she raised it to my mum's mouth, she turned around and started chatting to one of the other carers, laughing, talking, sharing anecdotes. My mother sat there, mouth open, terrified, trapped in body that no longer let her speak or move. She was regularly dressed in other people's clothes. On one occasion, her feet had been squeezed into somebody else's shoes. They were obviously far too tight as her toes were all punched up, but of course she couldn't say anything, and there was no one there who had time to listen. The last trip my mother made outside the home was when in an ambulance, when her body seemed to close down, basically, end stage of dementia. It was around this time of year, but much colder, bitterly cold in fact, and we think she'd had a stroke, nobody was really sure. I found out afterwards that she'd been bundled into the ambulance wearing just a thin nightie, no dressing gown, no blanket, or even slippers, and shockingly, no notes. No one from home went with her, as I was told, as the night staff were handing over to the day staff, so there was nobody available. Even the hospital were appalled, but said it wasn't the first time this had happened. I eventually found my mother several hours later, lying beside the corridor in A&E, motionless and speechless, just looking haunted. She was the woman with no name. Talking to people who also had family being cared for, I heard the same stories again and again. We tried to talk to the home, but they wouldn't listen, and of course we didn't want to cause a huge fuss because we were all frightened it would be taken out of our relatives. Through London Citizens, I've been enabled, as have members of 35 other communities in North London, that might have changed now, to conduct a listening campaign, a campaign that has involved a staggering 3,500 face-to-face meetings. These meetings reveal sadly stories not dissimilar to mine. The people were different, but their experiences weren't. These stories were then taken to the North London Delegates Assembly when we voted to make care an issue that we wanted to work on. And after over 18 months of research, local actions, analysis, building relationships, meeting with politicians, local and national, we've certainly come a long way. But with your help and support, we can only get stronger and more effective, and maybe even change the face of care and caring, not just for my mother, but for all our mothers, fathers, friends and family. Thank you.
Good evening, everyone, and thank you very much for giving me the opportunity to express my views about why ethical practices are important to me. My name is Perrin. I'm a young and healthy woman. I have a university degree, I speak 3 languages, and still, I am every day very humbled by my job as a care worker. Providing care to people is the most demanding work I have ever carried out, and this as a former events and hospitality project manager. I give people dignity and joy. My job is a complete dedication to others and requires many skills, among them tact, intelligence, adaptability, moral and physical strength. So yes, I chose freely to carry out this work because this is a vocation to me. But I am not foolish. I know with the skill that I have, I can get good money and further improve my own living standards. That is why Penrose Care is the only care provider I would work for, because they acknowledge the fact that you can't ask people to carry out the best care, forget about themselves, and pay them little money. That is called sainthood, and I do not picture myself yet as one. Paying your care worker a decent salary, like a living wage, paying for travel time, providing sufficient training, are key to promote an excellent level of care. If you provide dignity and respect to your worker, they will do the same to those they care for, supporting a virtuous cycle. At Penrose Care, we're approaching the Citizen UK Social Care Charter, but unfortunately, we're still a handful in the sector, and too many of my colleagues are still not valued and respected for their hard work. Thank you for your time.
Thank you very much, Michelle and Maureen. I have so much respect for what you do, and I'm incredibly grateful that you let us listen to your experiences. They really help us to understand the realities of social care in Barnet and put our proposal into perspective. The agenda that we're putting forward specifically entails three things. Firstly, the communities in Barnet hear more stories. Care isn't necessarily something that people talk about a lot, but I'm sure you can tell from what we've just heard that hearing what people have gone through really highlights the individual issues within care. So we'd like communities to run active listenings to help increase understanding of the problem. Secondly, that people meet with the person in the council in charge of elderly care. This will help us to share our stories as well as hearing what the council are working on. And lastly, we have dementia-friendly training or an intergenerational event in all of our institutions. This will allow everyone to feel safe and valued as a Barnet citizen. I hope that this has helped you to understand what we want and why we want it. If you would like to be part of the new dynamic team who are going to change the way care is run in this borough, please sign up at the end. We need at least 5 of you to take the campaign forward. Thank you.
So thank you to the social care team. This evening we're going to still hear about the